Ashley Kelly. I'm a nursing student at Northwest Florida State College in Niceville in the BSN program. And I'm presenting a project today, an evidence-based presentation, a critical analysis of literature. I'm doing this because there's a clinical concern in my department as an emergency nurse in which we place Foley catheters in our patients and encouraging the risk of Foley catheter-associated infections. My PICO question for this presentation is that in adult hospitalized patients with indwelling Foley catheters, does the removal of the Foley catheter within 48 hours as compared to those who leave the Foley catheter in past 48 hours reduce the risk of the patient receiving a catheter-associated urinary tract infection throughout their acute care hospital stay? And I looked through multiple different databases and found 4 resources in 4 different databases: in the ProQuest database, in the EBSCO database, in the Gale database, and the Medline database. The first resource I utilized from the ProQuest database was entitled Success of Reminder Systems in Reducing Catheter-Associated Urinary Tract Infections. This was from the American Surgeon Journal. The purpose of this article was to implement reminder systems in the patients requiring Foley catheters so that the length of indwelling time would be shortened and therefore reduce the risk of catheter-associated urinary tract infections. This article indicated a need for 2 separate time periods, in which the first time period was a survey of 460 patients before the insertion of the Foley catheter, and the second time period being after the Foley catheter protocol had been in place. The study indicated that the implementation of the reminder system decreased the length of time Foley catheters were in use, and in return decreased the incidence of Foley catheter-associated infections. Within the first time period before the implementation of the reminder system, there was an occurrence of indwelling Foley catheters being in place for 3.1 days. In the second time period, when the Foley catheter reminder system had been in place, there was a decrease in the Foley catheter insertion time to 1.8 days. The resulting shortened length of time indicated that the urinary tract infections per 1,000 catheter days were reduced from 7.8 to 3.5. The strengths of the study was that it was a well-designed study. It developed appropriate methods for measurement of new systems, and the findings supported the need for such a system in the hospital. The limitations of this study was that the data was collected only on surgical patients and therefore was not a broad study area. The data was collected during a brief period of time and would not indicate long-term use of this system. The second article I chose was called A Review of Strategies to Decrease the Duration of Indwelling Urethral Catheters and Potentially Reduce the Incidence of Catheter-Associated Urinary Tract Infections. This article was a study done by authors and published in Urologic Nursing. This was a literature review of multiple different articles from different online databases. This article indicated that there was a need for nurse-led interventions and informatics-led interventions to reduce the indwelling time of Foley catheters and subsequently decrease the incidence of urinary tract infections. The findings were that both nurse-led chart reminders and informatics-led computer reminders decreased the amount of time that Foley catheters were in use in patients and therefore reduced the amount of urinary tract infections seen in patients in the hospital. The strengths of this study were that it represented patients in several settings: patients in critical care, medical, and surgical floors. The study was also done in multiple countries, including the United States, Canada, France, and Thailand. It also resulted with the same conclusion in each study. The limitations are that not every one of the studies reported confidence intervals, which made the statistics of each reliable, not less reliable. Some studies reported different lengths of time that they considered short-term catheterization, causing some dispute in the definitions. The third article, it was called On the Road to Zero CAUDIs, CAUDIs standing for Catheter-Associated Urinary Tract Infections, Reducing Urinary Catheter Device Stays, How a Culture Shift, a Quality Improvement Project, and Electronic Solutions Reduced one hospital's incidence of catheter-associated urinary tract infections. This article was created by a woman named Catherine Smith and published in the American Nurse Today journal. This article was interesting in that one woman created this need and saw a need in her hospital and implemented a process in her hospital to reduce the indwelling time of Foley catheters, specifically in the medical surgical floors. They implemented this study and audited patient charts on a medical floor in 2012 before the protocols had been changed, and again in 2013 and 2014 once the protocols had been established. In this specific hospital, they implemented time-limited catheterization orders, focused clinical education, and nurse-driven protocols for catheter removal in the hospital. Were able to exceed their goal in reducing urinary catheter device and delaying time. The nurses began advocating for fewer catheter insertions and removing Foley catheters sooner, and they even was a resulting decline in urinary tract infections due to this advocacy for their patients. They focused on evidence-based practice and promoted patient safety, and then educated the staff each shift in reducing the use of Foley catheters. Based off of their work, 22% reduction in Foley catheter use from 2012 to 2013, and a 20% reduction in catheter-associated urinary tract infections. There's 39% reduction in Foley catheter use from 2012 to 2014, and a 45% reduction in the catheter-associated urinary tract infection of these patients. The strength of the study was that it was well designed and utilized guidelines from the Healthcare Infection Control Practice Advisory Committee. It was provided education to staff based on best practices and continue to maintain and monitor the interventions for years to come. It was limited in that it tested only patients in one setting at one location and could leave room for bias as the practice was implemented at the facility that the author created it at. I chose these 3 articles because they each came from different areas: post-op surgical patients in Article 1, nursing informatics and nurse-led interventions in Article 2, and one specific hospital interventions under Article 3. However, each one of these articles all led to the same conclusion, that catheters inserted in patients and indwelling for longer than 48 hours or short term leave patients at risk for higher incidence of catheter-associated urinary tract infections. The evidence reveals that the reduced length of time the catheters in place creates a reduced incidence of associated infections. Most facilities have accepted this as common practice and to be their Foley's pulled and no longer in place for more than 48 hours at a time. Unfortunately, not all protocols that are established in hospitals are strictly followed due to lack of staff compliance and poor education or training in proper Foley catheter care maintenance. This serves as a barrier in this particular research study. Urinary tract infections comprise 40% of total healthcare-associated infections and should be taken seriously. Medicare and Medicaid have determined that catheter-associated urinary tract infections are considered a never event and will not be reimbursed by the insurance companies to the hospitals because of the cost of this condition. Catheter-associated infections can lead to mortality in the critically ill and increase the patient's length of stay in the hospital, incurring more debt in the hospital bills. Throughout the implementation of reminder systems, nurse-based protocols, clinical education, and staff compliance, the occurrence of catheter-associated urinary tract infections can be significantly reduced in the hospital setting.